welcome to Research and Justice for All, a podcast series from Health Affairs. This season is sponsored by the Deloitte Health Equity Institute and focuses on drivers of health. Drivers of health are the conditions of the environment in which people live, work, and play, and the impact they have on health outcomes. At the Institute, we're creating cross-sector collaborations and tools aimed at addressing disparities in drivers of health and structural flaws in the health system. Learn more about how we advance health equity in the show notes.
This is Research and Justice for All, Season 2. I'm your host, Rhea Boyd. Thanks for joining us today. If you like what you hear, click and subscribe to listen to future episodes. Today we're going to be joined by Kimberly Driggins. Kimberly is the Executive Director of the Washington Housing Conservancy, a nonprofit based in Washington, D.C. that is reinventing the housing system to create a more equitable pathway to opportunity and prosperity for folks living in the DMV or the greater Washington, D.C. metro area. Kimberly, welcome to the pod.
Hi, thanks for having me, Dr. Boyd.
Of course. So to start, tell us a little bit more about yourself, because I know, like many of our guests, you wear a number of hats.
I'm Kimberly Driggins, and I'm the Executive Director of the Washington Housing Conservancy in Washington, D.C. My career has really been in urban planning and development, mainly here in the D.C. area, but also did a stint in Detroit recently in the last 10 years, and have really spent my life really thinking about urban places and really thinking about mobility, economic mobility for people of color and how best to achieve that. I've worn many hats. I've worked in the private sector as a consultant. I've also worked in government. My longest stint has been in local government, 15 to 16 years total. And now I'm in the not-for-profit space and loving it. And really, that perspective, that vast perspective, really helps inform the work that I do and really the challenges that we face. And so very committed to cities, very committed to making sure that African American and other people of color really thrive in cities, especially cities that are experiencing great pressure on the market and displacement. And I think DC is a city that is ground zero with respect to that.
Tell us more about the Washington Housing Conservancy, or the WHC, and what it is you do there.
The Washington Housing Conservancy, we're a young organization. We were established 6 years ago in 2018, and we're really filling a gap in the market. We really focus on workforce or essential or attainable housing. I gave you 3 words, mainly because workforce is a little controversial, but it really is for people who make a decent living, but they don't qualify for subsidized housing. So this class of housing is often called workforce or obtainable or essential. And the who, this is like your teachers, your first responders, your daycare workers, your hospitality workers. Again, folks that make a decent living, but their wages haven't kept up with the cost of living. And they are, quite frankly, the most rent burdened proportionately, like high levels of being overly rent burdened, mainly because, again, they don't qualify for your traditional subsidized housing or your traditional affordable housing. So the Washington Housing Conservancy, we specialize in this market. We specialize in being mixed income. So we serve a range. We serve everyone from a voucher resident to a market rate resident. And we believe in the mixed income model. We believe that that is a key pathway for economic mobility and really solving some of the challenges that traditional affordable housing often experiences. And we also are committed to the region. So we work in not only just DC, but we work in the suburbs and inner city or inner rung suburbs of the greater Washington area. And so we really are focusing on an area where there's very little resources for this group. We are also focused on making sure that we're acquiring buildings close to high quality transit and in high opportunity neighborhoods. And, I'd like to talk a little bit about, the high opportunity neighborhood. And most of our affordable housing in this country is really in places where the dirt and the land is the cheapest. It's so expensive to build affordable housing, and it requires a lot of subsidy, especially at the lowest income band. The housing often is not where people have access to fresh and healthy food, where they have access to amenities like quality transit options. And it's just a matter of fact. So the Washington Housing Conservancy, we are a preservation strategy. We acquire existing apartment building communities and we keep rents reasonable. And we keep rents reasonable where the pressure on the market is the greatest. And so this is where your affordability, no matter where you live in the country, is being lost at the greatest rate. These apartment buildings traditionally go to for-profit developers who are looking to buy these buildings and to make improvements and to raise rents, ultimately pushing people out. So we are a complete disruptor in the system and in the market. We are having some level of success, and we hope to be able to scale our model over the next 2 to 3 years.
I mean, first, you've got me, right? I am absolutely fascinated by this model and your approach, because I think from my vantage as someone who doesn't work on housing, but has some kind of cursory sense of how housing is a critical driver of health, often the conversation I have about housing is about the unhoused or folks who are housing insecure. And so you're focusing on a really unique population that I kind of want to drill a bit more into, because I wonder if we include in our interventions the folks who we really should be focusing on in the nation's housing crisis, the population you're talking about, it gives me the sense that we're actually talking about maybe most Americans. Like, it seems like we're talking about a lot of people, a lot more people than the sometimes more niche population that we can describe as the unhoused. So can you tell us a little bit more about who these folks are? You mentioned some of their jobs. And if you have any numbers for the DMV or that greater DC metro area, like how many people are you guys trying to serve?
It is really, I always say we're a more upstream solution, right? Like, we definitely need people focused on the unhoused, and we need people focused on the lowest income, but it's a continuum. And the people that I'm talking about really are, your everyday average citizens, residents, people who are living paycheck to paycheck. One event, one medical event, one, losing your job, like that they could be homeless. Like we saw during COVID, we saw during the pandemic. We've seen, a spike when you have a crisis that leads to the unhoused or the homeless, increasing their numbers. And we're trying to prevent that from happening at all, right? Like, trying to prevent that. And so we're also looking at, a population where, I think you need a lot of solutions and you need a lot of innovation. Let me just say that. I think in the housing field, in the housing industry, there really hasn't been much innovation over 40, 50 years. And you can see it as a result of the housing crisis getting worse and worse, no matter where you live. And so there are more solutions that are needed. And we just thought that, look, there are a lot of great not-for-profit affordable housing organizations that are working at the level in terms of the lowest income, and even some great organizations that are doing work with the homeless. And we do have some PSA voucher residents, and those are folks who are formerly homeless. So we actually do touch that population once they're actually in our buildings. But the folks that are what you say middle income. This is middle income workers. This is blue collar workers, middle income workers. Again, people who have a steady paycheck. They could be salaried, but their wages aren't keeping up with the cost of living. That's just the bottom line. And in high cost markets like the DC, the DMV area, the Bay Area, New York, Miami. I mean, you name it. I mean, even parts of Vermont. I mean, we're seeing a housing affordability crisis across the country in places that we haven't seen it before, in addition to the metro areas I just outlined. And, you really do have people that need affordable housing that wouldn't necessarily say that they do. I think that there's a stigma actually around affordable housing. And I think we've othered it in a way that's actually not helpful, not useful. What we really should be talking about is housing affordability and not really being overly rent burdened. There's a rule of thumb that you shouldn't be paying more than a third of your expenses to rent. And when you look at that, you ask me about the numbers. I could tell you about, close to 50% across the country pay more than 30% of their income goes to rent. That's almost half the population. I mean, these are some seriously big numbers. We need these solutions and we need to be more upstream. Some of us need to be thinking more upstream to help mitigate, what's being experienced at the lower income levels and homeless, because it gets a lot more challenging and it gets a lot harder in terms of pulling together resources than at the band that I'm working with. And I will say, we use a social impact investing model. We don't rely heavily on government funding because we feel that the government funding should be going to the most in need, to our most vulnerable citizens. And part of our value proposition is that it's going to take more than government to solve this housing affordability crisis. And so the social impact funds that we've created, the ones that we tap, really lean into corporate America, foundations, philanthropic foundations, private donors helping solve for the crisis and for the issue. And that's unique. And I would say, there's a lot of progress. There's much more progress to be made with respect to that. I'm not seeing that corporate America is seeing this as a crisis, but it actually affects their workforce. It actually affects regional competitiveness in a region in terms of it is so tied to, this is a health show, but it's tied to health outcomes. It's also tied to economic outcomes. Housing is just so fundamental.
I'm so excited we're getting to talk today because I feel like we can drill down into some of these issues that sometimes in health, absolutely, but even as a society, I think in America, just have like a cursory understanding, and that housing has something to do with economic outcomes, especially for, like you said, African Americans, Black folks, and other communities of color. And I think society probably has a cursory understanding of some of those relationships being partly government driven and partly private driven, right? The history of redlining, the Federal Housing Administration actually supporting the devaluing of homes in areas that were predominantly Black and other folks of color, and how that affected the ability to build wealth in Black and other communities of color. So I feel like people have kind of some level of understanding of those connections, but maybe we can drill down a little further, because I think it's really interesting to say that this isn't just on the government, because the role of the government in backing those mortgages, both historically during the beginning of the 20th century, during the problems of redlining, and more recently, right, with the financial crisis in 2008, where, again, it's not just mortgages, subprime mortgages that are issued by private lenders, but there's the ways the government also failed to fully regulate the industry to protect homeowners, which had a disproportionate impact on communities of color and Black folks in particular. And so some people might say, actually, it is the government who owes people something. And I am based here in California, and there are a number of projects underway. By projects, I mean policy initiatives to have a serious conversation about what reparations means in our state. And part of that conversation is driven by the underdevelopment of communities of color and Black communities in particular, and the ways the housing market has excluded Black folks from participating, and how that has shaped economic outcomes over time. So say more about why you think it's not just the government who should be on the line for fixing this housing affordability crisis, and what it means to hold kind of private agencies also accountable.
I'm going to put reparations in the parking lot for a moment. But I think I'm a realist, and I have a sense of urgency, right? I have a sense of urgency. And I think that the reparations argument, it's a valid one. I just think it's going to take longer. And I'm trying to move quicker, faster, and I'm trying to bring more people in. And, I also think that it's bigger than the government is willing to spend and allocate. So let's just talk big picture. You look at Department of Housing and Urban Development, and you look at their budget and their appropriation. It's pretty minuscule when you compare it to Department of Health and Human Services, when you compare it to Department of Defense. I mean, you barely register. So what I'm saying is that, like, as big of an issue as housing is, we actually don't appropriate that much money. When you look at the budget, the federal budget, and you look at those key agencies, HUD actually isn't one of them. It's, the Department of Defense, Health and Human Services, Department of Transportation. They're way more, Department of Labor. Like, those agencies, when you look at way more money is appropriated to those agencies than housing. I'm not saying that housing doesn't get money, but when you look at it proportionally, when you look at it across agencies, it's pretty small. It barely registers. That's point number one. And then I actually think that we need to be looking at budgets like Department of Human Services and thinking about the intersection of health and housing, and can some of those dollars actually go toward housing production, right? Like, need to be looking at some of those other agencies, the infrastructure bill that Department of Transportation has. Like, I'm trying to cobble resources wherever I can find them. But part of housing, when I said earlier that we've othered housing, it's almost like who we think of. I think there's a lot of stereotypes around housing, just like the 1980s and welfare and who was on welfare. You think about affordable housing, and many people think public housing. Right? That's not the entirety, right? They think public housing, they think assistance, and they often think, Black folks, people of color, right? And there is these explicit and implicit biases about, they need to work, go get a job. I mean, like, all of that, right? I think feeds into, kind of where we are. What we're saying is that, the people who are in need, it's greater than just a defined sort of like what you might traditionally think of, homelessness or very low income. Yes, that segment is hurting. Yes, they are in need of quality, affordable housing, and people need to be dedicated to that. But that's really not the tip of the spear. That's kind of like the tip of the spear is actually, in this workforce essential housing, and really trying to make sure that those folks stay afloat to try to help prevent possibly a backslide, right? And I think when you're looking at the totality of who's in need, you need to get creative about how we address the problem. The government is finite number of resources. And I think that, just like ESG.
First, just a little background for the listeners. ESG is a shorthand, right, I'm looking it up now, for an investing principle that prioritizes environmental issues, social issues, and corporate governance. So it's like responsible kind of quote unquote investing. So ESG is how you talk about social investments.
It's about corporate responsibility. ESG is a corporate term. The private sector already has a way to kind of tack into this, get into this ESG, and I'm just putting out there that why can't ESG be more than the environment? You could talk about triple bottom line. It can also be about, our people, not overly rent burdened. And again, sometimes these corporations help exacerbate a housing crisis, right? It's an unintended consequence sometimes of companies relocating to an area, especially high-paying companies, high-paying jobs. I mean, we've seen it across the country. The tech sector in particular can sometimes have an outsized impact on housing costs. And so, it's not lost on me that sector has actually dialed in. Has actually helped create some of these social impact funds that I talked about earlier, not just the one that we created, but others that they manage. And I think that, for eds and med sector, you think about hospitals. Let's look at that. Hospitals, the medical profession has the full suite of people that I'm talking about, right? Just from who they're servicing to who their workers are. And they have to be close, ideally, to their jobs. So there is a value proposition in the medical field, in the health field, I think, for housing, not just of its workers, but also who they're helping, that, and they have funds, right? They have pension funds. Like, they're already investing their money somewhere. And what I'm saying is, can you take some of those pension funds and invest them in affordable housing or create impact funds? It's actually a safe return on investment when you look at it that way. So, I'm full of I don't want to say great ideas, but good ideas. And I just think that we need to be thinking out of the box. We need to be thinking across sector. And I spend a lot of my time doing that. I'm a blue sky thinker. I think, how do we bring more people to the table? And I think that there's a win-win here, especially in the health field when it comes to housing affordability. It is critical I see it as critical to y'all's mission. And I think it's also critical to your, to your workers. And, I am kind of shocked that more people aren't in the health field talking about this in real ways. Because the good news is the healthcare industry, health field, they don't actually have to even create the housing. They can partner with organizations like myself and others that, we know what to do. But it's that partnership that's needed and resources that's needed to move the dial.
You also mentioned some of the similarities between, or maybe a similarity is the right word. You mentioned some of the ways there might be some synergy between the housing industry and the healthcare industry. I just did a quick little search, and another similarity is kind of the sizable slice both account for in our nation's GDP. Like, these are not small, tiny, little niche industries, that you're talking about. Healthcare, according to CMS, the Center for Medicare and Medicaid Services, a federal agency, is, as of a couple years ago, about 17% of the GDP. Healthcare spending is. And spending in real estate is comparable. We're talking about $3 to $4 trillion a year our nation spends in these industries. And when you have industries that are so large and so profitable, right, that money goes to somebody, there's often some more nefarious private actors, honestly. And there's a lot of competition. So for you guys to be an organization that is buying up real estate in communities that are growing, that risk gentrification, frankly, that risk shifting the population that's served by the housing stock while they increase the cost of living for the folks that live there. How how do you manage such a competitive market? And what's your competitive edge? How are you even outbidding folks who want to change that into,
luxury,
a Starbucks, and a luxury condo?
Yeah, luxury condo. So we're swimming upstream. I said, we're a disruptor. We're having some success, but it's tough. I'm not going to lie, Rhea. It's tough. I mean, we lose more than we win. But we, where we're successful is in jurisdictions that have policies that value affordable housing, right? And so one of those policies is right of first refusal. So pretty much in all of the areas that I'm working in this DMV, the district, Montgomery County, Prince George's County, every place except for Virginia actually has a right of first refusal, meaning the government can step into a deal and say that it has affordable housing goals and effectively sort of pauses the market rate transaction. It pauses it and it has a pre-qualified list of mission-driven developers, for-profit and not-for-profit. And if one of those folks can meet the price in a timeline, say 90 days, 120 days, the project goes to one of those organizations. And that has been tremendously helpful for us. This region has some of the most progressive affordable housing policies in the country. I think that we are definitely leading the nation and the tools in our toolbox to help solve the problem. And we're still, we're still sort of just having our head above water, right? The jurisdictions have affordability targets. They have housing goals. They look at where the housing is needed. And it's not just in the lower income areas. Many like Northern Virginia, Arlington, the district, we're looking at all of our neighborhoods and saying, about access and opportunity. So I give this region a lot of credit. You have to have an environment. You have to have political leadership that's supportive. Also, I would say, that's really huge. So that's helped us. We've also relied on the power of partnerships to meet the price. And so how we're held accountable is that our affordability goals are codified in our legal documents. And so we're providing affordability for 99 years in 2 of our projects. Our minimum is like 20 to 25 years. That's you're doing good when you can do like anything over 15. That's the low income housing tax credit minimum is 15 years. We're exceeding that. And the 2 deals that I mentioned that are 99 years, that's through a partnership with Amazon's Housing Equity Fund. And that's a social impact fund for affordable housing. And they're operating in the 3 main areas, which is the DC region, Seattle, and Nashville. And it's been a very powerful partnership because they're able to provide low cost, flexible capital. And we're able to access that capital and provide affordability where there wouldn't be, an opportunity to do so for pretty much, in perpetuity. Just to put a finer point on this, most affordable housing deals are 95% government funded. And it's the low income housing tax credit when you're looking at new construction that is the main driver of and producer of housing affordability. It also is one of the key drivers in preservation and gut rehab. So that tool in and of itself is responsible for an outsized proportion of the affordable housing that gets produced in the country. And it's an amazing tool. I'm all for it, but it can't just be one. And, just think about that. And think about, how much the problem is just getting worse and worse. So I just say, it just demands more in terms of innovation, in terms of who is thinking about solutions.
Absolutely. I want to switch gears to make a couple other connections. The first person I think of is Dr. Martin Luther King Jr., folks think of him obviously as a major civil rights leader, and some maybe the major civil rights leader of his time. And perhaps we think about, the March on Washington or the Montgomery bus boycott or some of his more publicized work. But towards the end, what became the end of his life, he was laser focused on poverty and specifically talking about housing and dignity and what the type of housing, the quality of housing, the conditions of housing that people were living in said to people about themselves and their own worth, and what it said about society and what we think of certain groups of people, especially Black folks and folks of color. And I think that thread, that national conversation he was beginning again towards the end of his life that he, was unable to fully carry out, I think was picked up in ways by Princeton sociologist Matthew Desmond, who wrote the book Evicted, a Pulitzer Prize-winning book. So I'm, not somebody who's just saying that book's good. It won the Pulitzer for exploring, I think it was 8 families in Minneapolis and their experiences with housing insecurity and eviction. And again, he makes the point that there is something deeper about housing that says, and the housing we allow people to live in, that says something about their humanity and how we treat them as a member of society. And so I want to ask you more about what it means for us to house such a large population of people. Because again, you're focusing not primarily on the unhoused, but on most of us who may be a paycheck or two away from being housing insecure or being on the street, or who may be one unpaid rent or one unpaid mortgage away from being out of housing altogether. And so I want to ask you 2 questions here. One, what for you is the connection between housing and larger social concepts like our humanity, our dignity, and maybe even loneliness, our relationship and care for each other? And 2, knowing that it's so important to keep housing and so many of us live on that razor's edge where we might lose our housing, what is your organization's approach to eviction as an organization who is housing people actively, and perhaps as an organization who, you mentioned, works on policies or thinks about policies that help kind of protect affordable housing for people?
Yeah. Oh, wow. I wish we had all day. So let me start with the latter, the last question, and try to go back to the first, although those are just, that's an episode each. But here's the thing, we're a mixed income model. So we're serving a variety of residents at different income needs. And so that we know from failed housing policy that concentration of poverty actually doesn't work, right? Like, with the housing projects that were built, almost all of them have been torn down and have been remade. Like the public housing has been remade as mixed income. The first iteration was Hope 6 under the Clinton administration. The next iteration is really Choice Neighborhoods. These are all programs that came out of Department of Housing and Urban Development, HUD. And this is really looking at their portfolio, which is public housing, right? And, the public housing produced some I think it was successful initially, but then I think that it really it led to, poor health outcomes. It led to violence. It led to, just even where it was located, the biases in the environment, like environmental racism, where some of this housing was located. So, I feel like, there's a responsibility. When you know better, you should do better. And I think that the current affordable housing policy really does sort of value and think through mixed income, and not just, kind of mixed income. We do it at the property level, but also like at the neighborhood level. Like I was saying, like, affordable housing typically is concentrated in lower income areas with less access. And you think about what that means around how you feel, where you're kind of in areas of lack, we're in areas of opportunity, and that's intentional. So, we have an anti-racist framework, and, we think about racial equity. And first and foremost, how WHC thinks about racial equity is where we're located, that we're in high opportunity neighborhoods where there's access to things, to amenities such as, again, high opportunity or grocery stores, quality schools, or schools are on the rise, access to public transportation, quality transportation, and good social services, networks, healthcare access to. We actually do asset mapping before we buy a property to understand where we are and how far we are to amenities like a quality health clinic or a hospital, where the grocery stores are. We actually do that like on the front end, and it is a but-for test for WHC. And as we think about the people in the mix, because we have everything from voucher residents to mixed to market rate, we think about how do you activate that mix? So for us, it's not just about not being overly rent burdened. The activation of the mix of people is actually key to economic mobility. It's actually key. Like, we feel that it's an inherent advantage to be in a mixed income community, but we know that people don't necessarily interact with people that they don't know, that they're not comfortable with. Again, you can't tell. We don't have anything like all of our units look the same. So you'd never know if you were a voucher resident or a market rate, right? Our finishes are the same in the apartments. We have no pour doors. There's one entrance. I mean, you really don't know. But we want to bring people together because we think bridging those lines of difference lead to strengthening community, right? You talked about, Martin Luther King and one of the things is his beloved community, right? He wrote a lot about beloved community and what that is. And, we really want, we have high ambition and high aspiration, and this work is not easy. We intentionally think about, bringing people together who want to come together. It's not Orwellian, it's not heavy-handed, but we create compelling invitations to participate in community building. We do a number of community building events across our properties. And it really is about getting to know one another and humanity, like our differences, our strengths, and uplifting what the community is, reflecting what the community is in our communities. And so that, we started during COVID. And, that is when people were retreating, we couldn't come together. But, when we were coming out of COVID, we were like, well, how are we, people were, understandably reluctant. I think that, we lost the muscle as a society during COVID around interacting. And I think it reinforced, I think the loneliness epidemic started before COVID. I think COVID exacerbated that pandemic of loneliness. And I think that, our communities are generally smaller. And it's good old fashioned, like old school tactics around, bringing people out, celebrating cultural events, heritage, thinking about, resident led engagement, whether it's a paint and sip, whether it's a book club. We have women's healing and listening circles that we've created. And that's really because we have our social impact coordinators on the ground, and their main job is to interact with residents to understand what their needs are, their desires, because ultimately we are trying to move from one of fear to one of aspiration. If you're not overly rent burdened and you're able to save money, what does that free you up to do mentally as well as, physically? What can you do? Can you invest in going back to school? Can you invest in your children's education? Can you think about starting a business? when you're living paycheck to paycheck, it's a mentality of scarcity. And we're trying to move to a mentality of abundance. And that really starts with two fundamentals, the housing affordability and stability. We provide long-term stability that home ownership typically provides, and knowing that your rent is not going to increase above a certain amount, say 2-3% a year, and that's sort of locked in, and really thinking about the economic mobility piece. And those things reduce stress, that we're living in quality housing. So you're not looking at lead. So like some of those health drivers are driven by the stressed out nature of living in these buildings typically. And we're trying to mitigate that. And we're trying to activate and maximize the mixed income environment that we have, because we see it as a competitive advantage. Last but not least, you asked about evictions. So that is absolutely the last thing that we want to do. Sometimes it is unavoidable. So I'm not saying that we've never evicted anyone, but that is certainly the last course of action. We have a rent relief fund. We created it. It's part of our model. This is prior to COVID. What shifted is the need to fund that rent relief fund. It's called Emergency Reserve upfront when we close. So we have a fund for people. We know that hardships are going to come. And so we have, it's an application process. We ask people to expend the federal funds or local funds that might be available. We also partner with a CSU, which is a credit building platform for renters. They also have a rent relief fund. So a CSU works, you don't typically get credit it does, like on time regular rent payment is not reported to credit agencies, right? And so when you're thinking about economic mobility, most renters struggle with establishing credit, right? So we've partnered with a platform that actually on time regular rent payment goes to building credit, goes to establishing credit scores, and it's a do no harm. Right? We don't negatively report to the agencies. And that partnership, they also have a rent relief fund that our residents can tap. So our residents can tap two funds, possibly more, but one fund that we have, and we have it across our portfolio, the ASISU Rent Relief Fund, as well as the local monies that might be available. Now, those have dried up substantially, local funds for rent relief. But some, I guess, depending on where you live, are available. So, we're thinking about, the ecosystem, what could come up. And, there is an application process. But it's we want people to be able to access this funding.
So one thing you talked about today is the value and power of bringing people together. Later this season, we'll talk to Sarah Heminger, a local leader who founded Thread, a nonprofit based in Baltimore, Maryland, that addresses the impact of social isolation among young folks. And it's not lost on me that both of you are taking on different forms of division that have traditionally separated Americans by race, by class, by part of the country or neighborhood you live in. And it feels like you're taking on this issue of divisiveness when it otherwise seems at an all-time high. We're so polarized and separated as Americans.
I think that there's so many things that are going to happen in the next 10 to 15, 20 years. And you're going to have even more people, thinking about or housing insecurity than we have now, unless we really get creative, leverage our funding opportunities, think about collaborative partnerships, and really I think the health industry, healthcare, for me, it's a partnership that makes the most sense, that we would be partnering more intentionally around solutions to combat the epidemic that we're experiencing.
Wow. You shared so many beautiful pearls with us today and just really helped us drill deeper into an issue that, like at the top of the episode, I said, I think all of us know something about. All of us know housing is important. All of us have some idea that there is an affordability crisis, and many of us have been directly touched by it in our families or perhaps the community or clients or patients we serve. So it's been really wonderful, honestly, personally, for me to get to learn a bit from you and your work, and I hope our listeners feel the same way. Thank you so much for joining us, Kimberly.
Thank you for having me.
Thank you. Kimberly Driggins, everyone. Thanks for listening. This is Research and Justice for All, Season 2. If you like what you heard today, please click subscribe or send this episode to a friend.